Good afternoon. Let's start with the X-ray. Which one is abnormal X-ray with your opinion? All, actually it's all. But this fact is, all of this X-ray image are representing an abnormality in the cardiovascular. But the days that the X-ray give a specific diagnosis for the anomalies in the cardiovascular system, it's gone already. Due to the advanced other modalities and the reality that this anomalies usually delay to manifest their signs in the late childhood, and the fact that most of these anomalies are treated surgically and need to follow up so we missed the specific sign for these anomalies. The value, as we said before, the value of the classical finding are decreased due to this fact. But still, in my opinion, as a radiologist, that the radiologist could be the first person who suggests that this anomaly could be a cardiovascular anomaly, not due to respiratory distress from the first X-ray image. And still we have some signs, some specific signs which could suggest the cardiovascular anomalies. We can mention to some of these signs. The first sign is eggs on string signs, which could be seen in the transposition of great arteries. This is the normal finding in the chest X-ray, and this X-ray for cyanotic child with grossly enlarged heart shadow and narrowing of upper mediastinum, giving this appearance of egg of strings. The whole heart enlarged due to the convexity of the right atrium, and the at both sides, and the narrowing of upper mediastinum due to atrophic change in the thymus due to stress, which give this appearance, which could suggest this malformation of transposition of great arteries. Another example. Okay. Okay. Snowman signs, which represent, sorry, I can't see from, okay. The total anomaly of the pulmonary venous return. Sorry? Yeah, that's what we talked in the beginning. Okay, but we can go through some specific finding which could become more clear in the late childhood. So this sign, the total anomaly of pulmonary venous system, usually all the drainage become in the single vein, which go through a vertical vein draining into the left brachiocephalic vein, which give this appearance on the X-ray. The paratracheal, right paratracheal, due to prominent superior vena cava, and the left due to the vertical veins, and the rest of the heart, it's giving the body of the snowman, which give this signs of snowman, the head and the body. Okay. Semester anomalies, this bending shadow at the medial portion of the right lung could be due to, anomaly of the vessels draining of the right lung. Sometimes draining into the inferior vena cava, and also may drain into the portal vein or hepatic veins. And the size of this sign or the size of this vessels depends on how many portion of the lung it's draining into this vessels. This diagram can explain the draining vessels, which become more enlarged in this case. Actually, this is an angiographic sign. This is a stenosis of outflow tract of the right ventricles, which given the appearance of gooseneck, narrowing of the outflow of the right ventricles, and the convexity of the other portion of the ventricles in this angiographic finding. Okay, this is a very common sign, very famous sign. It's figure of 3 due to the correlation of the aorta, due to dilatation of the aortic arch, the stenosis, and the dilatation of the descending aorta, which giving this appearance of figure of 3. Or in the angiography, we can see the dilatation before and after the stenosis. And in the barium swallow study, we can see this reverse 3 sign, which also represent the indentation of the aortic arch upon the upper portion of the esophagus. Another very famous sign in the tetralogy of Fallot, it's a boot sign. The apex of the heart, it's uplifting up due to a hypertrophy at the right ventricles. And there is another anomalies also, stenosis of the pulmonary, and the overriding of aorta, and the VSD defect. Another example of both. The grossly enlarged heart here due to Stein anomalies, giving the appearance of box appearance of the heart. Another example of the hypertrophic right ventricle and displacement of the tricapsid valves, and the stenosis of pulmonary artery, and enlargement of the cardiac shadow. The conventional angiography, it's common nowadays because of the advanced modalities, imaging modality, but this modality is still important in the guiding of therapeutic procedure, like in this example in the pulmonary stenosis, while this balloon dilatation of the stenosis through the angiography. Again, the advanced modality define the morphology and the connection and the function of the anomalies become rapidly more useful tools. the echography, which depends on the examiner itself, how much he is expert, which can be done on the antenatal and the neonatal period, can give highly details and anatomic formation of the cardiac anomalies, give a functional information, and the color Doppler can detect the stenosis or regurgitation areas. But this modality is limited in post-surgical cases and also decreased due to, in the all children, due to decreased acoustic windows. Here is an example for ventricle septal defect. So the flow between the left and right ventricles. Another example from echocardiogram shows dilatation of left ventricles in a child with dilated cardiomyopathy. Here is another advance in the CT angiography, which is more useful in the evaluation of anomalies. It's often give more details about the area which can't reach by echography, give more details about the structure and the connection between the structures and the relationship between these complex cases. Also, it's very useful on the following of post-operative complications such as stenosis and occlusion and pseudoaneurysm. The benefit of CT scan include the rapid acquisition times, which avoid the need of sedation and could be especially useful in the ill infants, and it can give us a good access for the lung visualization. The disadvantage of CT scan, mainly the radiation for babies, and also it's depend on the IV contrast, and it gives less information about the function of the cardiac function. MRI give more details about the anatomy and functional information. The advantage also include there's no radiation in the MRI and give a many key imaging sequence and different technique like a black blood and cardiac gated spine echo and bright blood cardiac gated spine echo. So it can give us a good idea about the flow abnormality and give us a better contrast between the myocardium and the lumen of the cardiac chamber, and also give us a dynamic information about turbulent flow or stenosis and regurgitation. And the processing data, which can obtain from the cardiac MRI, can give us function information, especially about ventricle ejection fraction. MRI angiography is another technique which uses the gadolinium, which can clear the anatomical relationship between the anomalies. You can see some example about how much details we can obtain through this modality. In the CT scan, here we can see ventricle septal defect, two ventricle septal defects. Another example in the MRI, atrial septal defect by MRI between the both atrium, which can guide the procedure for closure. And here is an antenatal ultrasound show clearly this arterial defect in this child. Congenital pulmonary stenosis, very nice image by CT angiography and volume rendering, show the stenosis of pulmonary and post-stenotic dilatation of pulmonary artery. PDA or patent ductus arteriosus. CT angiography show the connection between pulmonary artery and the aorta. Another volume renal image show clearly the connection between them. Another example for the semester anomaly by CT scan. This reformate image show how long and the size of the draining vessels from the right lung, which draining in the inferior vena cava. And the axial image show this tubular hyperdense structure in the right base. (3D) for coarctation of aorta. More clear details about the hypoplastic distal arch, the stenotic area, and the dilatation of descending aorta, and the collateral vessels between the pre-stenotic and post-stenotic areas. A coronal reformate image show the dilated chertuous intercostal arteries, and another image show the stenotic area and dilatation before and after. An example also about the total anomaly of pulmonary venous return. All the venous return communicate in single vessels draining in the right atrium, superior vena cava, inferior vena cava, right atrium and right ventricles, and upper and lower pulmonary veins. Another example about the draining venous system in the left and atrial defect on this MRI image. Tetralogy of Fallot. This post-surgical treatment show the stenosis of the pulmonary stenosis and the graft between the right ventricle outflow tract and post-stenotic area and the native stenosis. Here in the axial and volume rendering. Another example of post-surgery showed the shunt between the right pulmonary artery and right brachiocephalic artery and the stenosis of left pulmonary artery. Another example of Heterotaxia Syndrome. Here in this X-ray, we show that the shadow of the liver is in the left side of the abdomen, and the gas bubble of the stomach in the right side. And this MRI reformate image shows that the liver in the right side, the left side, and draining right hepatic vein and the left hepatic vein draining in the right atrium. Another example about the anomalies of left coronary arteries, where there is a fistula between the left coronary artery and right atrium, and a large coronary artery, and which is seen in the angiogram by significant dilatation of the left coronary artery which filling the right appendage. Either we can review the information, the one we start with it, that the cardiovascular anomalies can't be diagnosed only by X-ray, and the advanced modalities playing more significant roles in the diagnosis and follow-up of these anomalies. Echography in the antenatal and neonatal stage is the main corner of the diagnosis, means diagnosis, to characterize the cardiac anomalies and demonstrate anatomy and function, and could be technically limited in the older children, adults, and in the post-operative patients from the lack of adequate acoustic windows. And CT scan, an excellent method who can explain the anatomic relationship of complex anomalies and structures, and seen, which couldn't seen by echography, especially the pulmonary artery conduit at the aorta, and at the post-operative complications such as stenosis and occlusion and pseudoaneurysm. And CT scan, it's favorable due to easily obtained in the critical ill patient, because we don't need for sedation. MRI give us more details about the anatomy and functional information, and he have the advantage of there is no radiation in this study, in this procedure, and give us more details and special relationship between the structure and evidence about the dynamic flow, which could be related to a stenosis or regurgitation, and functional measurements such as ventricle ejection fraction. Thank you.
Thanks, Dr. Sammy.
Yeah.
I think we are behind time, so if you have any questions, our colleague is here, our Dr. Khalid, Dr. Muhammad, Dr. Nader, Dr. Sammy. Any question? Yes, Doctor.